Hello everyone, welcome to my YouTube channel, Medbuddy. Today I will discuss about the topic monkeypox. So the virus belongs to Poxviridae family. The Poxviridae family is a member of Orthopoxvirus genus. This is double-stranded DNA virus. Double-stranded DNA virus. Okay. And this is the part of the same family in which the variola virus, the smallpox virus, the same family, Poxviridae family, monkeypox is also the member of same family. The symptoms are similar to smallpox symptom, but they are milder, and monkeypox is rarely fatal. It is not related to chickenpox. There are two distinct genetic clades of monkeypox virus. One is the Central African strain, in which the death rate is around 10%, and this is rare. Second is the West African clade B. Death rate is around 3 to 6%. The incubation period of virus ranges from 5 to 21 days, or 3 to 15 days in MOHFW guidelines. The first human case of monkeypox was recorded in 1970. Prior to 2022, monkeypox has been reported in people in several Central and Western African countries. This is a viral zoonotic disease. That occurs primarily in tropical rainforest area of Central and West Africa, mainly a disease of West Africa. That is also clade B Wally strain. Death rate is around 3 to 6%. It is usually a self-limited disease. The symptom usually lasts for 2 to 4 weeks. Severe cases can occur. In recent time, the case fatality ratio has been around 3 to 6%. This is the diagram of monkeypox virus. So what is the mode of transmission? This can spread from person to person transmission through direct contact with the infectious rash, scab or body fluid. Through respiratory secretion it can transmit during prolonged face-to-face contact, during sexual contact, through genitals and perianal lesions on genital and perianal region. Even by transmission is by touching the items like clothing, linen that previously touched the infectious rash or body fluid. Vertical transmission is also there from pregnant female to fetus, from infected animals, either by scratching or bitten by the animal, or by preparing the food or using product from an infected animal. Spread from the time symptoms start until the rash has fully healed. Okay. Time of spread is from when the symptoms start, that is from when the fever starts till then the rash has been fully healed and a fresh layer of skin has been formed. Sign and symptoms of monkeypox: fever, headache, muscle ache and backache, swollen lymph node, usually lymphadenopathy. That is usually not present in other type of pox viruses like variola or smallpox. So we can differentiate it from lymphadenopathy. Lymphadenopathy, unilateral or bilateral, usually cervical lymph node, submandibular, submental or inguinal. Lymph node can be involved. Associated with chills and rigor, exhaustion, respiratory symptom like sore throat, nasal congestion and cough. Usually rash is a characteristic feature. Appear like a pimple or blister that appear on the face, inside the mouth, and then other part of the body like hand, feet, soles, and then genitals, anus or on the trunk. Infection phase is divided into two parts basically. One is the invasion phase and second is the skin eruption phase. When the invasion phase, usually 0 to 5 days, in which patient is having fever usually moderate to severe grade, associated with chills and rigor. Then sore throat can be there, cough then can be there, dry or wet, any kind of cough can be there, intense body ache, myalgia, arthralgia, generalized malaise, back pain. These all are symptoms in case of early invasive phase. And then one characteristic feature is lymphadenopathy. Lymphadenopathy is distinctive feature of monkeypox, as I discussed it earlier. Then the skin eruption phase begin 1 to 3 days after the appearance of it. Okay, the rash initially start in face usually, around 95% of cases. So rash is centrifugal. First face, then you involve hand and feet also, and trunk also. Rash can be present on genitals and urogenital region. Therefore, sexual transmission can be there. Oral mucosa, conjunctiva, these can be involved. Okay. So the phases of rash. First phase is ananthem. First lesion to develop on tongue, mucous membrane can be involved. So first lesion to be appear on tongue. Then macule formation. Macule formation is there. Flat lesion present on arm, legs, and then hands. Face, then arms, and then legs. Can involve tongue. This take usually 1 to 2 days. Okay. Then is papule phase. This is papule phase. This also lasts for 1 to 2 days. Flat lesion has become raised. Then is vesicle phase. That is pus filled. Okay. Clear fluid has become yellow. Then pustule, and pustule is umbilicated. This is characteristic feature, that pustule is umbilicated. Okay, this phase usually lasts for 5 to 7 days. Then pustule will ulcerate. This is the ulcerated lesion. Then crusting and scar can form. Fever usually do not occur at the time of rash formation. But if present, we will think of secondary infection of the rash. So the complications: secondary infection, fever at the time of rash, immunocompromised state is there, so pneumonia, sepsis, encephalitis can be there. Corneal involvement, cornea and conjunctiva can be involved. Severe cases, usually mild cases are there. Mortality is 3 to 6%. Recent epidemic is of West African clade B strain. So severe cases occur in children and depend on the extent of virus exposure, nature of complication patient has developed, and patient health status, comorbid condition. Okay, So according to MOHFW, these are MOHFW guidelines. Case definition. Suspected case. Suspected cases, history of travel, last 21 days. So history of travel in last 21 days to the affected countries in which epidemic has been occurring. Okay, then unexplained acute rash with more than or equal to 1 out of these signs and symptoms, which we have studied already, that is fever, lymphadenopathy, headache, body ache, profound weakness. So this is only suspected case. Then we will confirm the case. Confirm the case by laboratory confirmation. Laboratory confirmation by detection of unique sequence of viral DNA with the help of PCR and or sequencing. PCR or sequencing, gold standard. Then it will be confirmed case. So the diagnosis. Clinical specimen. From where we can get the clinical specimen? From the lesion itself in EDTA vial. Okay. Serum or urine. Nasopharyngeal swab, oropharyngeal swab. Okay. Then specimen can be taken from lesion, urine, serum, oropharyngeal, nasopharyngeal swab. Okay. In EDTA vial. Then we will send it for PCR for orthopox virus gene. Okay, orthopox include, we have already discussed, cowpox, buffalopox, camelpox, monkeypox, etc. If this is positive and PCR is specific for monkeypox or RT-PCR monkeypox DNA is detected, then this is monkeypox. If this is negative, then to be investigated for other cases. This is confirmed case. Okay. So the management part. Principles of management are patient isolation. We should wear PPE kit to prevent ourselves from the infection. Protection of compromised skin and mucous membrane. Rehydration is very important. Then nutritional support, symptom elevation, monitoring and treatment of complication. So the supportive management of monkeypox is protection of compromised skin and mucous membrane. Like skin rash. If there is skin rash, clean it with simple antiseptic solution, then cover it with light dressing. If there is extensive lesion, don't touch or don't scratch the lesion. And if there is secondary infection, then antibiotic can be given. Otherwise, mupirocin ointment can be applied on this. Then for genital ulcer, sitz bath. For oral ulcer, warm saline or gargles. Topical inflammatory gel can be applied for relief of pain. Lesions are usually painless. They can be painful if there is secondary infection. Conjunctivitis can be there. It is self-limiting. If some system persists, then you can take ibuprofen. Then rehydration therapy, very important. So ORS, oral fluid, IV fluid if indicated, and proper nutrition. Then fever. For fever, sponging, PCM. For itching, calamine lotion or antihistaminic. For nausea and vomiting, antiemetic. Basically, there is symptomatic treatment. Headache, malaise, PCM and adequate hydration. So that is all in regard to treatment. Then prevention. Avoid close skin to skin contact with people who are having rash that look like monkeypox. Okay. And then don't handle or touch the bedding, towel or clothing of a person with monkeypox. Wash your hand often with soap and water or use an alcohol-based sanitizer. And in Central and West Africa, avoid contact with animals that can spread monkeypox virus, usually rodents and primates. So this is all about monkeypox. Thank you very much. Please subscribe and